Religion, diet, and health. Talking about religion is a very sensitive topic for many individuals because they think others will make unfair assumptions or judgments about them or discriminate against them because of their beliefs. This may be especially true if they are not members of a mainstream religion. While some ethnic groups may make up a considerable proportion of a particular religious denomination, one should not make any assumptions about an individual's religion based on his or her ethnicity. For example, all Iraqis are not Muslim, and all Indians are not Hindus. For example, all Iraqis are not Muslim, and all Indians are not Hindu. Many religions teach that taking care of the body is a moral obligation and a ritual of faith, and thus have doctrines about the use and abstention of certain foods and beverages. Believers, however, may or may not adhere to all the doctrines and teachings of their professed religion. Religion and spirituality. There is no universal definition of religion and spirituality. Spirituality is often thought of as the universal essence of life and refers to beliefs about the supernatural. Spirituality also encompasses the moral code to which one subscribes. Religion is sometimes used interchangeably with faith, belief system, and organized system of worship. The role of religion is to explain the inexplicable, provide comfort in a chaotic world, serve as a moral compass, and provides meaning about the supernatural, sacred, The role of religion is to explain the inexplicable, provide comfort in a chaotic world, serve as a moral compass, and provide meaning about The role of religion is to The role of religion is to explain the inexplicable, provide comfort in a chaotic world, serve as a moral compass, and provide meaning about the supernatural, sacred, life, death, and life after death, and bring about a meaningful relationship with God or a higher power and fellow humans. Religious affiliation. The U.S. Census does not collect data on religious affiliation. However, the Pew Research Center conducts a religious landscape study periodically. The major world religions: non-Christian, Buddhism, Hinduism, Islam, and Judaism, and Christian, Protestantism, Roman Catholicism, Eastern Orthodox. Christian groups make up 70.6% of U.S. religious groups. Evangelical Protestant, 25.4%. Mainline Protestant, 14.7%. Historically Black Protestant, 6.5%. Catholic, 20.8%. Mormon, 1.6%. Orthodox Christian, 0.5%. Jehovah's Witness, 0.8%. And other Christian, 0.4%. Non-Christian groups make up 6% of the U.S. faith. Jewish, 1.9%, Muslim, 0.9%, Buddhist, 0.7%, Hindu, 0.7%, and other world religions, 0.3%, and other faiths, 1.5%. When we look at other faiths, those that say none, nothing in particular, make up about 15.8%. Other faiths, 1.5%, and the unaffiliated religious nuns, 22.8%. Of those of other faiths that are unaffiliated, make up the largest percentage of about 22.8%, atheists 3.1%, agnostic 4.0%, and don't know 0.6%. Christianity, both Protestantism and Catholicism, are rapidly declining in the U.S. All subsets of religiously unaffiliated groups, however, continue to grow. Religious commonality. Most religious groups have these things in common. They teach to practice love, forgiveness, taking care of others, honoring elders, charity, fasting, and most major religions believe in the principle of fasting. Fasting is done to prove that the body can rule Most major religions believe in the principle of fasting. Fasting is done to prove that the soul can rule the body, and some religions have prescribed days to fast. Pregnant and nursing women and those with health problems are often exempt from fasting, and the length of the fast and its strictness depend on the religion and the reason for fasting. Religion and health. Like culture and ethnicity, religion is an important determinant of an individual's perception of health and illness. The religious piety of the client often determines the role that faith plays in seeking medical attention, accepting of a diagnosis, complying with treatment and recommendations, responding to treatment, and recovering from the problem. Many clients understand the connection between mind and body and the connection between spirituality and health. Thus, they now seek healers of the mind and spirit, not just of the body. Many religions teach that taking care of the body is a moral obligation and a ritual of faith, and thus have doctrines about the use and abstention of certain foods and beverages. Believers, again, may or may not adhere to all the doctrines and teachings of their professed religion. Religious prescriptions range from a few to many, from relaxed to highly restrictive. These will affect a follower's food choices and behaviors. Religion and cultural competence. Religion is one of the dimensions of diversity and thus should be addressed in cultural competence training. At a minimum, healthcare providers should know the spiritual or religious affiliation of their clients and understand the dietary and health teachings of their religions to better serve them. Health professionals should also ascertain the degree to which their clients follow and adhere to their religious beliefs and make recommendations accordingly. Many religions mandate that women should be seen by female physicians, especially for gynecological and obstetrical care. And depending on historical and political factors, some patients may refuse treatment by health professionals from certain religion, race, ethnicity, country of origin, etc. This reinforces the need to recruit more health professionals from different backgrounds.